And finally, a warm welcome from friends from the media. We once again wish you a warm welcome, and we are hopeful and confident that this noble gesture will help many people in leading a normal life after the successful completion of cardiac surgery. Thank you once again.
Thank you, Mr. Saravanan Raman. And now I would like to welcome
colleagues, Mr. Shanmugam Priyan, who heads operations, and Mr. Saravanan and many others. Mr. Saravanan heads marketing for us. So we are very excited to be working together as a group because all of us have that common ideology. We want to believe that even though we are a very high-end medical service provider, we can work to be able to extend the highest qualities of care to the most economically underprivileged sections of society. With that, I would request my friend and colleague, Dr. Arul, to give us a few words about the impact of congenital heart disease on society, on families, and the burden that exists in our country, and the long way that we have to go as a healthcare provider in trying to alleviate this problem. Dr. Arul?
Awareness, both to the patients and even the doctors. Because when I was a postgraduate student, we didn't have any pediatric cardiology department, we didn't have the pediatric cardiac surgeon. I was not informed about pediatric cardiology. Only after gone on for a pediatric training, I realized there are more screening methods we have. Still, there are lack of awareness for congenital heart disease, limited knowledge for the practitioners. Even the doctors, some of them feel that congenital heart disease cannot be cured. That's the reality even now. And there are not many pediatric cardiac programs in India. So there is a map there. That is map, the line is called Chennai-Kanpur line. If you draw a line, most of the cardiac centers are in the west. There is nothing in the northeast. And even in Tamil Nadu, the most cardiac centers are here. Only 2 or 3 centers in Chennai, and one in Coimbatore, one in near Andhra. So only very few cardiac centers are there. You might ask why. Because unlike adult cardiology, there is little support from organizations. Because it's not a money-making specialty. And it needs a lot of commitment from a surgeon. Being a pediatric cardiac surgeon, you cannot sleep well at home. Because once he has done a surgery, his services will be needed in the ICU very often. And it's a very highly skilled and it needs a high talent to do this kind of procedures. That's where Dr. Adava comes in. He has got enormous experience and he is a committed surgeon. Next please. Above all, the important thing is a financial burden. Because these children are not the earning member of the society. So somebody has to sponsor them, either the parents or somebody else. There's a study published recently in 2015 in one of our cardiology journals. This study was done in Kerala. Most families, almost 75%, belong to either low income or below poverty line. Of that, only 4% had some kind of insurance cover. The normal insurance doesn't cover the congenital heart disease. As soon as they know this child has got heart disease, the insurance company will back off. They will not fund them at all. It is an expensive procedure because it needs a lot of commitment, lot of infrastructure is needed. So each heart surgery will be at least around 225,000 rupees. When the family comes for cardiac surgery, the median loss of man days is around 35 days and loss of job is almost 17 days. In this survey, they realized 80% of the families were in immense financial stress during this kind of surgeries because they didn't have money to do this surgery. Next please. What can we do as a society? There should be an universal coverage support from the public insurance schemes or help from the NGOs as associated trusts. And there should be a private-public partnership. And there should be a fixed cost. And there are multiple procedures needed for the congenital heart disease. Either it can be corrective procedures or a palliative procedure or temporary procedures. The corrective procedures are n number of procedures. Of them, now in the past 5 to 10 years, technology has developed so much.
Our Chittappa Badalchand Chordia, a very simple man, good-hearted, very noble. Because எதுக்கு இருந்தாலும் நல்ல ஹெல்ப் பண்ணிட்டு அவர் மனசில் எப்பவுமே இருக்கும். நான் அவர் கூட தான் அங்கே இருந்தேன் ரொம்ப வருஷமாக, ரொம்ப பக்கமாக பார்த்தேன். அது மாதிரி ஆள் ரொம்ப கம்மியாக இருப்பார். ஸோ தென் 1991 அவர் எக்ஸ்பயர் ஆகிட்டார். ஸோ அதுலேருந்து நம்ம ட்ரஸ்ட்டு ஃபார்ம் பண்ணி நல்ல ஒரு புது பெரிய அமௌண்ட்லேருந்து ஸ்டார்ட் பண்ணி ஒரு வருஷத்தில் 1 கோடி அது மாதிரி ஹெல்ப் பண்ணுறோம் ஃப்ரம் பை த ட்ரஸ்ட். ரெண்டாவது நம்ம ஹார்ட் ஆப்ரேஷன் 12 வருஷம்லேருந்து ஹார்ட் ஆப்ரேஷன் பண்ணுறோம். ஃபர்ஸ்ட் ஸ்டார்ட் பெங்களூர்லேருந்து ஸ்டார்ட் பண்ணோம். அப்புறம் அங்கே ஜெய்ப்பூர், இப்போ வந்து மெட்ராஸில் குளோபல் ஹாஸ்பிட்டலில் செய்தி பண்ணுறோம். அது ஹார்ட் ஆப்ரேஷன் ஸ்டார்ட் பண்ணுறதுக்கு அங்கே உட்காந்துருக்காரு முனையில் சாந்தி கங்கரியா, அவர் நம்ம தம்பி தான். அவர் தான் அது ஐடியா எடுத்து வந்து நான் அதெல்லாம் ட்ரை பண்ணி பேசி அப்புறம் முடித்தார். அப்புறம் அவர் பக்கத்தில் உட்காந்துருக்காரு சுபாஷி, 2 பேருக்கு சரியான ஜோடி. அவர் என்ன சொல்கிறாரு அவர் அது மாதிரி பண்ணார். ஆனால் யோகனை பண்ணி பண்ணுவார். சும்மா சொல்லிட்டு இப்படியே எல்லாம் செய்யறதில்லை, நல்லா யோகனை பண்ணி பண்ணுவார். அதனால தான் அது வேலைக்கு மேலே வந்துட்டு இருக்கு. அப்புறம் சார் இப்போ அங்கே குளோபல் மெட்ராஸில் ஸ்டார்ட் பண்ணுறதுக்கு அங்கேருந்து அது ஒரு 2 பேர் தான் முக்கியமாக டிஸ்கஸ் பண்ணி ஸ்டார்ட் பண்ணி ட்ரஸ்ட்டில் வந்தார். அப்புறம் அது நம்ம ஸ்டார்ட் பண்ணோம்.
இல்லை, அது பாலம். இது வந்து ஃபினான்ஸ் பிஸ்னஸ் பண்ணுறவங்களுக்கு கரெக்டாக செட் ஆகுது. Sri Badalchand Chordia, when he came to Chennai, migrated to Chennai, he started finance business here, and he was very particular about this saying, "Paakada nilamille kekkada kadanille adu paadum." He earned money. He and his wife, they didn't have any issue, and the money which he has saved, he earned, he made. Both of them decided this will go for needy people. And the followers, like Subhashi Prasanjansa Chordia, Subhashi Bafna, they in 1991 Sri Prasanjansa expired, and after that his wife wanted all good things to be done only for the needy people. The entire capital has been used for good cause, and then Sri Shantilaji Kankaria, my elder brother, I am proud to say that my elder brother, he entered in and he gave in a noble idea. He had a talk with Dr. Devi Shetty, Narayanidale, Bangalore, that I will arrange money for your hospital and what you will do for needy people. That time Dr. Devi Shetty has agreed, and they had an M.O.U. of regularly doing heart surgery, open heart surgery, no cost from the needy, poor patients. And this journey began around 13 years back. There are some 14th year this is.
Tomorrow it will be 14 years.
Tomorrow it will be 14th anniversary. Good time that we have again here we started. So till now, around through Shantilaji Kankaria, around 3,000 and odd operations has been done all over from India, even